1 in 5 American adults experience mental illness each year, and suicide is the second leading cause of death among children aged 10 to 14. Today, mental health is much more prioritized than before, and there are many ways to reach out for help, including in-person and online therapy, journaling, and medications. But how was it back then? We've seen attempts at treating mental disorders since the earliest surgical procedure back in the Mesolithic period, or Middle Stone Age, called trephination. Trephination is when a hole is created in the skull to relieve pressure or release evil spirits that were believed to be causing mental illnesses or neurological disorders like epilepsy, which causes seizures, or sudden bursts of electricity in the brain, which leads to mild symptoms, like a spell of confusion, or more serious, such as uncontrollable jerking of the arms and legs. Amazingly, many patients given trephination survived, and it is still used today to relieve cranial pressure or draining a subungual hematoma. Later on in the Middle Ages, bloodletting was used since it was believed that purging the body of its unbalances by releasing blood or vomit would heal physical and mental disorders. Additionally, mental asylums became popular during this time in the 17th century, where patients were subject to physical methods like isolation and restraint, first with chains and shackles, and later on, straitjackets. Later on in the 1940s and 50s, lobotomies were becoming popular. This procedure involved surgically removing parts of the brain, especially the frontal lobe and prefrontal cortex, and this could be finished in under 5 minutes. Of course, our understanding of the brain wasn't as expansive as today, and practitioners ended up causing patients to become docile and apathetic, which was believed to be a success since their symptoms of paranoia or aggression subsided. But in reality, it was the result of severe personality changes, and it led to them losing their critical thinking skills like planning ahead or expressing emotions, which was highly controversial and unethical, so it quickly fell out of favor when non-invasive methods such as antidepressants were introduced. Today, with our understanding of the brain and methods of treatment, mental health isn't so stigmatized, and many patients can go on to live a normal life. If you or your loved one is dealing with a mental health crisis or suicidal thoughts, please call this hotline. Thank you for watching. I know today had a heavy topic, but show some support if you want to see more interactions with medicine and history in my videos. Thank you.